Hi folks, Nick the Nurse here. Today we're going to be talking about some of the nursing interventions associated with the nursing problem of hypertension. So let's get started. With the patient who has hypertension, we as nurses, in preparation for our nursing school exams and to do well on the NCLEX, want to make sure that we monitor blood pressure and vital signs. Remember, during the nursing process, we want to make sure that we assess before we intervene. We wouldn't want to treat somebody's blood pressure with antihypertensive medications if their blood pressure was tanked and it was completely low. So we need to make sure that we assess before we act or we provide an intervention. Additionally, we want to encourage the patient to lose weight. Again, I'm certainly not one to talk. I've got definitely some weight that I could stand to lose. But a patient who is obese or is overweight oftentimes is going to be more at risk for developing hypertension or even having their hypertension increase because of the increased workload on the heart and on the vessels in the body. Also want to make sure that we encourage the patient to eat a diet that is low in fat, low in sodium, and low in cholesterol. We want to encourage the patient to not eat foods which increase blood pressure, such as caffeine. Coffee certainly is a big thing. Sodas, even diet sodas, oftentimes will have a significant amount of caffeine. And you folks know who you are, the ones who download those energy drinks, the Rock Stars and the Red Bulls, and you want to have wings, but those things can come back to haunt you later in life because of the hypertension that's associated with them. So be careful, encourage your patients to be careful and do things in moderation. We also want to encourage the patient to maintain a regular exercise regimen or program, of course, after consulting with their physician, and encourage the patient to stop smoking because smoking, a vasoconstrictor, a very potent vasoconstrictor, can lead to hypertension. And we don't want a hypertensive patient who smokes to stroke out or have a heart attack or have angina or anything like that. So we also want to encourage the patient to try non-pharmacological remedies to control their hypertension, such as guided imagery, meditation, yoga, progressive relaxation, biofeedback, things like that, because those have been shown to lower blood pressure. I know myself, oftentimes before an exam, excuse me, I'll stress out a little bit, eustress, which is kind of a good form of anxiety, but oftentimes if it's a really big event, I'll kind of get a little bit nervous. And one of the things that I personally will do is I'll go, just kind of breathe in through my nose and out through my mouth, and what that does is it lowers my heart rate, probably lowers my blood pressure, and I feel a lot more relieved after doing some deep breathing. So encourage your patient, walk them through that as part of your nursing process. And it's a good thing to do, and maybe even for yourself. Encourage the patient to reduce unnecessary stress. Easier said than done, right, Nick the Nurse? Yeah, it's not easy to reduce stress in your life, but it's possible. Life is so fast nowadays, especially when you're in nursing school. Nursing students never stress, right? Or when you're prepping for the NCLEX. I know I was extremely stressed and had a lot of anxiety before I took my boards. You have to make sure that you keep that anxiety and that stress controlled, okay? Administer antihypertensive medications as ordered. You know, we can do with some patients, we can do all of the meditation in the world. We can have them eat the best diet in the world and have a good exercise regimen. And oftentimes, none of that will make a difference. Some people, they can lead a completely healthy lifestyle, yet their blood pressure is going to be high. Well, that's why God invented antihypertensive medications. Therefore, one of the best things that we can do as nurses is encourage the patient to adhere to a lifelong commitment to antihypertensive therapy in the form of medications. Yes, all the non-pharmacological treatments and interventions are important, but taking your blood pressure medication is the #1 thing that the patient needs to be reminded to do. Again, my name's Nick the Nurse. I want to thank you for watching my video today. If you'd like to check out any of my other videos, feel free. There is no obligation. You don't have to buy anything. Check them out, www.nickthenurse.com. I want to thank you for watching my video today, and I'll see you next time.